What's going on, everybody, and welcome back to the podcast. This is Drinks After Work. I was about to say something else. This is Drinks After Work with Shelly Nicole. Hope everybody's having a good day. Hope everybody had a good Monday. I didn't do that much today. I just went to the gym. Then I washed my hair, went to the store. I didn't do much. I kind of relaxed today, and then I came to see my parents. So, as you guys know, or if you don't know, April 11th to April 17th is Black Maternal Health Week. And it basically sheds light on Black women and their the maternal issues that a lot of Black women go through, the death rates being so high. Black women in the United States have a higher maternal morbidity and mortality rate than white women. In 2001, the maternal mortality rate for Black women was at 69.9 deaths per 100,000 live births, which is basically 2.6 to 3.0 times higher than the rate of white women. That's high. I don't even know how to scale that. I thought it was going to be percentage wise, but that's a lot. 69.9 deaths. That's a lot. That's alarming. Black women are also more likely to experience life-threatening conditions during childbirth, such as preeclampsia, postpartum, hemorrhage, blood clots, preterm birth, low birth weight, a lot of things. So I decided that this was going to be something kind of different from what I normally talk about. This is something different from what I normally don't record. And it's only about relationships and self-help, but I feel like this is also important because as a Black woman who wants to have children one day, it's good for me to know this information. Granted, the special guest that I have birthed me, and she's told me a lot of information that I know now when it comes to labor and delivery and being pregnant and everything like that. But you really don't know it until you experience it. So to prevent any life-changing or life-altering situations that could happen, kind of want to know the information beforehand. So I have with me, she is a registered nurse with over 40 years of experience in clinical as well as administrative nursing. She started in surgery but did the remainder of her career in obstetrics. She worked at various hospitals in Manhattan and in the Bronx in various roles. And she retired in 2020, has been on the move ever since, in high-risk OB. She currently now does childbirth education and teaching online and one-on-one consultations. That was her. What was I saying? Oh yeah, and she attends various webinars and programs that are centered around Black maternal health. So she's very passionate about this. She'll tell you how much she looks into this type of information and how much she wants women of color to really just pay attention to their health. She's licensed in New York and Connecticut, so if you are in any one of those states, you can get help, and she knows exactly what she's doing. But without further ado, Miss Ma'am.
Hello. Good afternoon, good evening, everyone. Glad to be here. Thank you for that introduction, Michelle. I appreciate it.
You're welcome. So we're going to start off, and basically, Mom, she's my mother. I didn't say that. This is my mom. Mom to me, Miss Hackney to everybody else. Why did you start? Or how did you start in nursing? What made you want to go into nursing, actually?
Change. Just this feeling, not wanting to be in a 9 to 5 and be bored, and be in a place and in an environment that if I wanted to change, I could change. And nursing profession offers that. It's a great profession, especially, of course, if you're caring for people and the outcome. It's great for raising a family because you could work day, evening, nights. You could work 8 hours, 12 hours, part-time, full-time, weekends. The scheduling is very flexible. And the different areas. You could work in the emergency room, ICU, obstetrics, medicine, surgery, in the clinics, in schools, in the armed services. I mean, the sky is the limit with nursing, per se. And so I thought that that was a great profession for flexibility and making money. You can make quite a bit of money. You budget your time correctly. And so that's how I started on my journey in the nursing field.
That's good. I mean, you've been doing it, like you said, 40 years, right?
Mm-hmm.
40 years you've been doing it, so there has to be some type of love to it, some type of passion for it.
What?
Okay, so the next question: why is the maternal death rate so high for women of color instead of white women?
The answer to that question is very multifaceted. There's several reasons for why we are where we are today. Several factors at play, and I'm just going to list a few of them. So it's not just one thing. There's structural racism, of course, in our country. Hospitals in wealthy areas keep those in need usually out. You have to have insurance or money. We profess in this country that healthcare is a right. It should be a right, but in many cases and in many different venues, it's a privilege. Getting quality healthcare. Conscious and unconscious bias that we all have. Breakdown of the family structure and lack of support within the family structure. Limited resources in the communities that need it most. A level of apathy in educating oneself about the labor process and options, that there are options out here for you. Overall health status of people of color, the environment, our diet, our mental health. Women waiting much longer to have children, thus becoming high risk and requiring a different level of care and monitoring. So those are just some of the factors as to why the maternal death rate and morbidity and mortality is where it is, particularly amongst black women. And it's, a multi-pronged approach in dealing with each of them individually. Some of them we can do something about. Some things we have to rely on others to do something about it and bring about change.
Yeah, I feel like some of the things that we could do is I think we can, black women, we can try to be more, physically fit, get into shape prior to getting pregnant. Like, we look at all the celebrities and we say oh, well, she's fit because she has the money, or she went to go get a tummy tuck, or she went to... No, that's just their lifestyle. That's what they do. Their body is their lifestyle. So they're just... They have to, make money off of their body. So that, yes, they're going to keep it up. And yeah, eating good. You definitely have to eat good. You can't consume all of this... what is it?
Processed foods.
Processed foods, and
we're going to talk about that,
which we are going to get
further down.
But I feel like we need to do better, which is good too. Because I going to the gym this morning, I seen a lot of black girls in the gym and getting their stuff together. But you don't see it often. You don't see a lot of black women physically keeping themselves into shape. So that I think is definitely true. Number 2, what can women of color do prior to getting pregnant to have a safe and successful pregnancy?
Well, you hit on it already. So I was saying that the question is coming up. You want to stay as healthy as possible. You want to keep your weight down. You want to take some vitamins, multivitamin, folic acid, different vitamins. You need to go to the doctor and find out what vitamins you're lacking so that they can recommend particular supplements you need to take. You want to eat healthy. Decrease your carbs, eat fruits and vegetables, exercise as you were talking about, and participate in stress reduction. What is the things that you do to keep your stress to a minimum so that stress hormone, cortisol, doesn't wreak havoc on your body and your organs and cause ailments over the long term. So basically overall health, just trying to be as healthy and live as healthy a life as you can. Limit the alcohol, drink more water, no soda, no juice, things that are sugary drinks. So just an overall body overhaul in terms of getting yourself in good shape.
I think that's something that, too, when I did the last episode, when I said take a lifestyle inventory, I guess now at this age, you have to, at any age you can take a lifestyle inventory, but I think when you want to bring a child into it, you have to really consider what it is you're consuming. And not the fast food stuff either. I haven't had McDonald's in so long. I'm very proud of myself. So having to just watch the consumption of what you eat outside of the things that you cook. Because granted, you all don't feel like cooking all the time, but still watching what it is you put inside your body. How has labor and delivery changed over the years from the time you began to now? Well, since you've retired.
Well, I want to say I started in my nursing, in OB, not in my nursing career, in OB with working with midwives, which I'm very blessed that I did that because I got right out the gate, I got an up close and personal view of seeing babies born without much intervention. And it was beautiful and great to see. And we saw various methods, various things that were practiced because the midwives pretty much did the delivery and ran things. Right now, fast forward, there's much more medicalization in labor and delivery. OB and obstetrics are the highest areas where lawsuits prevail. And so in many cases, this has led to the practice of defensive medicine. Overall implementation of procedures and testing, overuse of those procedures and overuse of testing has happened in obstetrics. Women are not engaged in the process to educate and advocate for themselves. They don't feel like they have a voice, being led by a system that many times does not have their best interests in mind. This is why childbirth education and advocacy work is so very important. Back in the day, you had one doctor you saw for 9 months, and that doctor had a partner maybe in their practice. And the doctor you saw for 9 months was the doctor that did your delivery. And that was just a very warm, and it was very reassuring to know that the person who's doing your delivery saw you right at the beginning of your pregnancy. So you developed a relationship with your physician. And that created a nice bond. Right now, these doctors slowly, over the years, they slowly merged. These doctor groups merged. So, for example, you had 2 MDs would merge with 2 other MDs, and that will equal 4. And it's call themselves a group. So and one of those 4 would deliver you. The patient was given an opportunity back in that time when doctors merged to meet all of them during their 9 months pregnancy. So it moved from having a one doctor to now a group to now where we are now. This ballooned, which in my opinion, ballooned into more confusion and disconnection between the patient and the provider. Patients would see different physicians throughout the pregnancy and not have that physician at their delivery. Today it's much worse. Communication is done by the doctors reading your history and notes on the computer. Relationships have taken a back seat. And on the labor floor, they've hired hospitalists, is what they're called, just to do the delivery. There's no relationship with the patients, but to follow policy, algorithms, and make money, and try to keep the doctor out of the law, from being sued. And this is where this defensive medicine comes in. And that's pretty much, in many cases, all over the country, how OB is practiced. And it's sad. It's sad. Many women don't even really realize it. They think they don't have any history to know, so they don't know where OB was. And even before I got into OB, the midwives who've come from Africa brought their skills to the table to do deliveries. And they were ostracized, jailed, and ridiculed, and labeled as being unsafe. And so that the deliveries then came into the hospital setting. And that was in a way for the hospitals to make money. And so there's a racial component with that. The black midwives were then were ostracized and unable to practice. And it was taken over a white male patriarchal system, which is where we are today. So we can claim it back. But with education, that's the first thing you have to know. And the next thing is you have to kind of know what kind of delivery and birth you want.
That was a lot. But
yeah.
That it's so. Do you feel like this is your personal opinion? Do you feel like most nurses now are just really just getting? Because I seen somebody say something about how nursing is now just becoming a thing that people are going for because of the money and not really caring about the actual job.
Well, yeah, and people are realizing that nursing is a stable profession. AI, there's all this rumor about AI replacing nursing. Maybe one day it may come where a robot comes into your room. Can I help you? And then there's a TV on the robot, and the TV is on somebody at home who then answers. But I don't know how that's going to be. Hopefully I'll be dead and gone before that happens, because nursing is a touching profession. It's a feeling profession, and you can't make machines feel. So that's number one. Number two, why people are going into it, like I said, a stable profession, make some money, and maybe some of the reasons are not genuine as to why they're doing it, and they're just doing it to make the money. That's the wrong reason to get into the nursing profession. But healthcare has been taken over by insurance companies and business, so they're looking at the bottom line, which is saving money, making $1, and sometimes it's at the cost of human expense. So you have to just look at the money trail and follow the money trail, and that's it's just sad. It's just a sad place that we're in, but it doesn't have to be that way. You just have to know your rights. You have to be informed, and you have to have a collaborative relationship with your provider, any provider you have.
Mm-hmm. Right. So what are women of color not doing to prepare for pregnancy, delivery, and after childbirth that you noticed over the years, or even just now? Because not even over the years, like when you see it online or people that you may know, or what are they just not, the questions they're not asking that they should be asking?
Well, it's educating themselves. No one, I think, is the false assumption that you're going to go to the doctor, you're going to go to the hospital, and they're going to have your best interests in mind. In most cases, they do. I'm not trying to put out a whole lot of fear or anything, but just to raise your consciousness. When you feel something is wrong or you're feeling a sixth sense, something is usually wrong. Trust that. If you feel you're being dismissed and you're not being answered and listened to because of the way someone is treating you, it's not in your head. It's actually happening. Trust it. My main thing is to educate yourself. You have to educate yourself in order to empower yourself. What kind of birth do you want? Women, for variety of reasons, have been surrendering their voice. And this can change. Like I said, misguided notion that the doctor and hospital will tell you all you need. What is missing is a collaboration and the engagement in the process for every single visit when you see your doctor. You have a responsibility. You're 3 months pregnant. You should be looking. You're walking around with a computer in your hand called your phone, your iPhone, Apple phone, whatever phone, Android. That's a computer. If anything you don't know, you have it at your fingertips a whole lot more than what I had 30 plus years ago. You can Google anything, and those things need to be brought to the attention of your doctor if it concerns you. Preparation after giving birth. Who is part of your village to help you? More women are choosing alternative family lifestyles, not married, same-sex relationships, and a variety of other types of family styles. You still need help and support early and beyond after the child is born. Who is in your village that's going to help you? Is it a neighbor? Is it auntie, grandma, your girlfriend? Who? You can't do this solo. And when I first started out by what is causing the maternal morbidity, mortality, you can't do everything. You can't do everything. You can't go work. You can't, I don't know if the social media or whatever is making you believe that you can do it all. You cannot. You need help. And you have to know when to wrestle in that help.
That is social media. Because everybody feels like, oh, well, this one can do it, or she gets up and after she has the baby, then she's right back to work, or she's not asking no question.
But that's false. Social media is lying. It's the biggest lie game out there. And if you subscribe to it and believe everything, that's the first problem. You don't know what kind of help people have. You don't know their hereditary, their medical history. Maybe they just don't hold on to weight, so their body snaps back quicker. Maybe they're breastfeeding, so they're losing weight. Maybe they have someone coming in so that they, at night to help with the baby so that they could get a good full night's sleep. Maybe you just don't know all of the behind the scenes pieces. And as far as celebrities, that to me is just really retarded and ridiculous for you to ever look at a celebrity and think you can mimic that. Because they have cooks, they have maids, they have, people to call.
Trainer.
Yes, they have all.
Everything.
That is it. That is who is in their village helping them. It's no different if you're working 9 to 5 and you put those things while you're on maternity leave to rest and have 1 or 2 people in your circle helping you.
That is true. So, how can you plan ahead? So that was actually one of the questions. What are some good vitamins you recommend?
Nope, I'm not recommending any vitamins.
But she's going to say
No, I'm not. I'm not a doctor because it's just the usual multivitamin and folic acid. But you need to sit with your doctor. They need to go over your blood.
You really need.
You go over your blood panel. What things are you deficient? Are you deficient in vitamin B12? Are you deficient in iron? Are you deficient in things? Those are conversations to have with your doctor. And if they say, oh, everything is fine, after they draw your bloods, excuse me, what does that mean? How is my iron? How is my folic acid? How is it? Bring up 1 or 2 things that you feel that you want addressed. It's very important that you do that.
And you can look at your chart now too. I know
Yes.
for a lot of hospitals.
Yes.
That my chart thing.
Mm-hmm.
Like my doctor has that, and I can look up when she drew my blood, like every little thing. Like I think it was something that was high, and I just emailed her and said, "What is this about?" And she's like, "Oh, it's nothing. You just had this. I think you had to eat this or that day, and that's why it was high." So you have the information is there, so you don't have to wait forever. You kind of get it like the next day. So that's not an excuse. But the diet, the exercise, what to buy, like how can somebody plan ahead for that? Diet and exercising. Watch what you eat.
Yeah, I mean that's you don't need someone to tell you that. I mean, you should just.
What do you think? A lot of people do need that.
Well,
to be told that, like to get up, walk around, don't just sit. Don't do the whole. What's the other thing that I hear people say? I'm eating for two. I can eat what I want, type of thing. Like
that's old school. Ignorant knowledge, and that's just not true. You don't need to eat for two. If you are carrying a baby, all you need is 300 calories more. If you're having a well-rounded breakfast, lunch, and dinner, if you're having twins, you need 500 calories more. That's about it. You don't need to eat a whole slab of ribs and a big pot of mac and cheese and say you're pregnant, so that's the reason why you eat it. No. That's you want it. No, and it's going to be.
Are you ever really that hungry though when you're pregnant? Like
no, I don't think so. But I think we try to get ourselves to believe that we are.
Mm-hmm. That makes sense. Okay, so your water breaks. You're in labor now. What should you do? When should you come to the hospital? Should you wait? Because I remember you said this before that. Just because your water breaks doesn't necessarily mean you have to race to the hospital. You can give it some time. Like, how long should your contractions be before you say, okay, it's time to go?
Well, just because your water breaks doesn't mean you're going to go into labor. And just because you start having pains doesn't mean your water's going to break. Two are not exclusive to one another. They are independent of one another. That's what the TV shows you. Water breaks. All of a sudden, mom then has to race to the hospital, and it doesn't usually work that way. So, really depends on your medical history and what you and your doctor plans regarding your breaking of your water. Most women get Group B strep culture at 36 weeks, and if it's positive, you have to get antibiotics if your water breaks while you're in labor. If it's negative, then it's negative. So you need to know your Group B strep status. Group B strep can be dangerous if the newborn is infected. So that's why they give you the antibiotics as a precaution. But in the past, back in the day, when I worked on the labor floor, we used to give moms 24 hours after their water break to see if they go into their own labor. Today, they're a little bit more, they don't do that. Once your water break, they want you to come into the hospital. So you need to discuss when you write your birth plan, kind of what you want to do. And it's based on your medical history. The water should be no other color but clear. If it's yellow, bloody, or green, you go to the hospital with or without labor pains.
So you don't have to come running into the hospital.
No, but let your doctor know. Say you broke your water, and then have that conversation on one of your visits and say, well, if my water breaks, what do you want me to do? Mm-hmm. And proceed and have a conversation.
So what is considered high-risk pregnancy? Does it have to do with age, race, or can it happen to anyone?
That's a loaded question. If a mom has any medical conditions like high blood pressure, diabetes, any autoimmune diseases like lupus or rheumatoid arthritis, cardiac issues, positive HIV, anything in that realm, all are high risk and should be followed by an MFM, a maternal fetal medicine doctor, for their care. And yes, age and race are factors in whether or not you're high risk. So if you're a 25-year-old black woman and you're healthy, you're not necessarily high risk because you're black. We look at the whole picture, medical history, so forth and so on whether or not you're high risk. The MFM doctor you'll see in conjunction with your regular doctor. So you'll have a visit every now and then, and the high-risk doctor is to watch your high-risk issue. That's new too over the years. Just one doctor took care of you. And if you went to the specialist, then the specialist took care of you. You didn't go bouncing back and forth to all these different doctors. It's ridiculous.
So are you high risk at so let's say you're healthy or whatever, but at what age are you considered?
Textbook wise, 35 years old and older are considered high risk because of your age. Because your eggs are old. That's why you're considered high risk. Could you be 36, 37 and healthy and healthier than a 25-year-old? Of course. But they're only going from the premise of your eggs and the age of your eggs and all of the potential things that can happen with aging eggs. So you are labeled a high risk, labeled elderly primate. That's a jacked up term, but elderly primate. An elderly primate after 35. It's terrible. They don't say that to the men. They just say that to the women. But that's a messed up term, in my opinion. So, yeah, it's not good.
Okay, so what do you feel about epidurals? How are you yay epidural, nay epidural? Or does it really go based off of
I think you got to re-examine and look at your pain tolerance. I don't think it's good or it's bad knowing your pain tolerance, so to speak. If you have a low pain tolerance, and how do you handle pain? How do you handle pain in your life? You have a headache, a hangnail, anything bothers you. Do you run to get Tylenol? Do you cry? Do you have a fit because you're in pain? That's what makes you up. It's not right or wrong. And to me, I find that that's a good indicator of whether or not you're going to run and get an epidural immediately or not. But you should understand that pain has a purpose in labor, and you can do your own research with that. You can go to Lamaze.com. You can go to evidence-based, BASED, birth.com, and you can read articles about the pain of labor and really what it does and what its purpose is. And once you understand that, I think, and women read that with an open mind, you might feel differently about running to get an epidural. I feel right now today, why? Because it's spoken about so much, epidurals. Oh, I'm in labor. I'm going to get my epidural. Oh, yeah, I better get my epidural. People talk about it like
it's
a piece of gum, and it goes hand in hand with labor, and it doesn't. There are serious ramifications in getting an epidural, and I believe it is increasing the chances of our C-section rate in this country and all of the other issues that can happen when you get an epidural and you're numbing the pain away in labor. So epidurals, I feel, are tied to lack of knowledge, fear, and the patient's pain tolerance overall in life. Well documented in many literature that to get an epidural, once labor has been established, you have been in labor for a while, you are at least 4 to 6 centimeters dilated, then that's the time pretty much you should get an epidural. Once you've been in labor for a little bit. It's pretty much written in a lot of literature. It's advised not to get an epidural, an early epidural. It increases, I'll repeat, it increases. It's not an absolute. It increases your chance for a C-section. You are taking the pain away. You're interrupting the pathways in your brain for the mom to have labor go on continuously. And once that is in place, we have to give you more drugs to bring back the contraction pattern that you're already having on your own. So the pituitary oxytocin is made in the posterior part of your brain, and you're making that on your own. Every woman makes it, You're having contractions every 2 minutes. You can't take it. Oh my God, I can't take it. You get this epidural. Now the contractions are not 2 or 3 minutes apart. Now they're 4 to 5 to 6 minutes apart. Okay, we want your labor to continue. So what do? We give you medication through the pump to bring these contractions back to every 2 minutes. So the medication for the epidural, the Pitocin, all of these drugs cross the placenta and go to the baby. So like I said before, pain has a purpose. You want to educate yourself about what this pain means to the labor process and what it does overall. There is dollars to be made from patients getting epidurals. There is. It's dollars, and it works on fear. And this medication long-term goes to the fetus, as I said. The pain from a synthetic medications given to the mom during inductions is more painful than you having your own natural labor pains. So everybody and their mother is being induced for one reason or another. And we are inducing these labors. And the pain is more painful than you having your own labor pains. In natural labor, as I said, you're producing your own oxytocin in the brain. So,
if you can, try to hold out.
Yeah, to at least 4 to 6 centimeters.
Or go the whole thing without having the epidural, if you can. And especially if you want a natural birth. And you have water births, and you have all these different type of births that you can reconsider before.
Epidurals also lower your blood pressure. If your blood pressure lowers, it lowers the heart rate of the baby. And if the heart rate stays low for the baby, then they say it's fetal distress, and that's when they give you a C-section. And no mother's going to say, hold on, wait a minute, I'm not taking a C-section. Just do what you got to do to bring my baby's heartbeat up. You're in a situation where you're, of course, going to act accordingly, and you want your baby to be healthy, which naturally so. And so it's a cascade of events is what I'm trying to get across. Once you get this epidural, they start putting you into labor. You're staying in the bed. You're not moving around. All of it is counterproductive to normalcy in having birthing children.
That's true. So, childbirth education, that's what you do now. Why is it crucial and very important to advocate for yourself? And not just be all, excited for the shower, excited for the gender reveal, but I think I don't hear a lot of people talk about childbirth education and wanting to take a class and wanting to know they're just going to go with the wind and see what happens. So why do you think they should do it? Especially now.
It is crucial and more important than ever before, due to the crisis in Black maternal health, morbidity, and mortality, for you to come to the table with some level of education. You want to try and bring a trusted friend or relative to your appointments. You want to prepare for your visit, have questions addressed. You want to have any questions you have, you want them addressed that you do not understand. Healthcare is a business, and these doctors got 20 patients to see, and each patient is allocated like 5 to 10 minutes. Oh, everything is okay. They flip through your chart, and you're in and you're out. Very little personalization, very little teaching, very little time to talk with you. You have to come there with your punch card or your thing on your phone and talk to your doctor and ask the questions you need asked, the resources you need while you're on each and every visit. You need to escalate to management if necessary, administrative or medical, if you feel you're being disrespected and not heard. Reevaluate what's important. You mentioned showers and gender reveal parties. I think it is just simply fabulous that pregnancy is celebrated. You have women at the beach showing their bellies. The whole Rihanna thing when she was dressing, showing her stomach. I just think it's beautiful that you're just celebrating this new birth and you're dressing accordingly and looking just radiant. When I was pregnant 30 years ago and even before, women wore these big blousy dresses and they just weren't very attractive. And it wasn't just celebrated just to show your belly. It was kind of like we were hiding it overall. But you have to reevaluate your priorities. Education has to be part of that shower and gender reveal, and possibly getting a doula, and make time to educate yourself. If you feel you're being disrespected, you have to want to change. You should change your hospital or provider if you're not cared for appropriately. And you must advocate for yourself. You are treated differently when you engage with your providers and you ask them questions. They perk up and they say, oh boy, she's really reading and she's this or she's that. And if you're feeling you're being disrespected, it's time to change hospitals and or providers. Don't feel you have to go to where you originally go. You need to look at Earth, the app, IRTHTHEAPP.com. It's like a Yelp system where moms put down their birth experiences and doctors and hospitals that treated them well and those that didn't treat them well. So women have a guide as to where to go. That is very much alive and prevalent, done by Kimberly Sellers. And I think that's phenomenal. It's an app. You should be consulting that app. Oh, I want to deliver at this hospital. I heard it's good. Is it? See what the patients are saying. If they're saying bad things about it, you need to reconsider going there and go to.
How you would go, like what you would do before you go on vacation.
Go on vacation, buy a car, anything else.
Yeah.
You shouldn't treat yourself any differently. Yes.
All right. So using a doula, because you mentioned a doula, how do you feel about doulas or what do you call them? What is it? Birth coaches.
Doulas. I don't like the doula term. Doula is a Greek term, slave. So I'm not feeling the word doula, but for all intent purposes, that's what's out here. Doula this, doula that. Doulas are very important, especially now. They are a necessary part of the team, and that it's there to support you and the partner. Some are free, some charge on a pay scale. You want to go to doulamatch.net, DOULAMATCH.net, put in your zip code, and see what doulas are in your area. Call a few, have a conversation. That along with your gender reveal and your baby shower and getting educated, you need to have a doula. Call 311. Many private doulas are on Instagram and Facebook. Do your research. The doctors are not going to tell you this. They're not. These are the things that you want for your birth plan and your birth experience. You have to seek out for yourself.
Very true. Very true. Like when you sit there on your phone and you're looking at dresses that you want to wear and what's going to be at this baby shower and how you're going to do this and that, just check out a doula.
Nothing.
Help yourself.
Yeah, nothing drives me crazy, more crazy than having a patient that I see sometimes and I ask them what have they done to prepare, and they're 7-8 months pregnant and they haven't taken a class, they haven't read a book. I'm just blown away. The apathy. And that apathy translate into they're going to just have their way with you in the labor room. Because you don't know anything. You have nothing to say, and you're just at the hospitals and the nurses and the doctors' mercy. You don't know. They'll tell you to turn to the left, you'll turn to the left. They'll tell you to stand on your head, you'll stand on your head because you don't know that maybe standing on your head is counterproductive. How do you know that?
Right. That is true. So social media can be a wonderful tool as far as what you see, like we were talking about the why am I drawing a blank? Like what we were talking about with the baby showers. There you go. The gender reveals and the pictures, the maternity pictures and everything. Social media is great for like interest and inspiration. But can it also intervene, I guess, with or cloud people's judgments about pregnancy and what they should be really considering and what they should be doing as far as like I said, getting prepared, like we've been saying, as far as getting prepared, like how much of social media should you really take in when it comes to this?
Well, like everything, social media has its pluses and minuses. People use that platform to talk about their experiences. I've learned some different things on social media and YouTube, but I don't think it's not the doctor, it's not the nurse, it's not a medical person. It's somebody's personal experience. So you have to take it with a grain of salt. Listen to it. Have a conversation with your doctor. I read I should take this or do that. What do you think? I saw this on YouTube. I saw this on Instagram about, the salve I should put on my nipples when I'm breastfeeding. And have a conversation with your medical provider. Look it up for yourself. You shouldn't be letting that be your doctor and your guide. Because if so, why are you going to the doctor? Take your vitamins, drink your water, have your baby, and don't even bother. Save yourself some time. You need to have it validated with some healthcare professional.
Yeah.
Most of them is just experiences and opinions.
Mm-hmm. And it's good. And that's the thing too. You guys know that social media is just like what people want you to see. People are not going to tell you the real life, what's really going on behind closed doors. Somebody could be having like the worst pregnancy ever, could be having swollen feet, nausea all throughout their pregnancy, but they'll just post a picture and it's like, oh my God, you look so happy. Like you really don't know what someone's going through behind the phone. So it's definitely good to make sure you know your information about your own pregnancy. So over the age of 35, like we were talking about, is considered high risk, right? So is there anything that a woman should do who's over the age of 35 or getting close to the age of 35 that they should avoid doing to just keep like a healthy pregnancy and just not, not to have any issues?
Everything I said before about eating healthy, eating healthy, living your best life mentally and physically, whether you're over 35 or not. Just to, I can't sit here and say, you take this, you take that, you do this, you do that. You should have a collaborative relationship with your doctor. If you're not pregnant, with your primary doctor. Say that you want to get pregnant, and maybe go for some preconception counseling that looks at everything, making sure your tubes, your uterus, your hormones to sustain a pregnancy is fine. Many women don't get preconception counseling. Some do, many don't, where they look at that particular aspect. There's maternal fetal medicine doctors do that and make an appointment to review your history. Other than that, they'll guide you based on what you bring to the table. So it's a different plan for everyone based on the findings and what they come up with.
Mm-hmm. So after a miscarriage, how long should you wait until you try again? And I know, like, I've heard a lot of people say, well, a lot of doctors say that they really don't know what causes a miscarriage. And I guess that's still true today, right? Like, you really don't know.
Well, miscarriages, for many factors, causes a miscarriage. It's not just one thing. Is it one-time miscarriage or repetitive miscarriage? It can be a clotting disorder. You may need to get, again, preconception counseling with an MFM to arrive at what the problem is. It could be a deficiency of something in your vitamins or your labs. Could be fibroids. It could be an incompetent cervix, a cervix that opens up on its own so it can't hold a pregnancy. So in that case, you might need a cerclage. That's a stitch that goes around the cervix to hold the cervix together like a purse string. So if you have one miscarriage or usually after 2, they'll do a workup to see what it is you're having. A lot of times, again, it's a clotting disorder. It's called thrombophilia, and you take some medication for that with a high-risk doctor so that you can maintain the pregnancy. That's it. So it's a lot of different reasons to cause a miscarriage. So after a miscarriage, how long should you wait? It depends on how many weeks you were when you had your miscarriage. Were you 7 weeks? If you're 7 weeks pregnant and you still want this baby, you still refer to it as a baby, even though it's 7 weeks, versus 21 weeks. Baby is older, but it's still your baby. Are you, going to bereavement counseling and taking care of your mental health with the loss? Because every woman deals with their loss differently. And so should you just jump right back in and get pregnant and have another one? Many women do that because the loss is painful, so they want to replace it with a baby. Some cases it works out. They carry a baby to term and everything is good. Some have another miscarriage. So each case is very individual. So you need to find a caring physician and get your history done and get to the bottom of why your miscarriages occur.
Should moms take it easy, like the first trimester? I've heard some people say like they don't want to do too much. They don't want to
that depends.
Move around. They don't want to pick things up. They just don't want to. They just want to sit there.
No, that's not good. It's no reason just to sit there. I wouldn't go running a marathon if you never ran a marathon because you're straining the body. But if you've been exercising, if you've been going for walks or going at the gym and you find out you're pregnant, you're just using common sense of what you'll do at the gym. But if you have no bleeding and if you have no medical indications to take it easy, you should just do what you normally do and use some common sense in how you proceed. Not really doing any significant or straining lifting. You want to watch your lifting and bending and picking up heavy stuff. But that comes under the umbrella of common sense. But do you need to sit there and be delicate? I think if you suffered miscarriages, and this is your 3rd pregnancy, and you've lost 2, maybe taking it easy and doing some of the things you just said might come to make sense for you to do. But you work closely with your physician on your plan and articulate how you're feeling so that you can have a successful pregnancy.
Okay. I don't know. I feel like sometimes, especially like with my job, I normally feel like the pulling and the pushing and the having to do so much work kind of makes it like, I don't want to say I contributed to people who may have had miscarriages, but I just feel like if you're doing way too much stuff in the first trimester, and like you said, if you're not really physically active to begin with, can possibly put a strain. But again, we don't know. We don't know what causes them. Everybody's health plan is different. Everyone has a different reason behind it. But yeah, so the next one, what was the other one we said was the next one? Importance of a family village. So who is your family village? Who should consist in the person's family village? Anybody that they feel
that somebody you trust and love.
Yeah.
That's different. It could be the neighbor. It could be the next. No, it could be the next door neighbor that you trust because maybe your family lives far away, and you look out for each other. So you swap numbers, they swap numbers. In case there's a problem, you knock on her or his door, and vice versa. But you have someone. So that's determined by yourself. But you should have at least 1 to 2 people, 3. That can kind of close friends, aunties, uncles, cousins, it could be whomever you've seen fit to help you in case of a crisis.
Right. Yeah, I grew up with a lot of aunts and uncles, and they weren't blood related, but I know that was just from my mother and father having a lot of friends from high school, college, through work. So, that became a part of her family village and my dad's family village as well. The last question is, so basically to sum everything up, the importance of having a birth plan and a collaborative relationship with your provider. That's ultimately what should be kind of like the first thing on a mom-to-be's mind. Or like, again, we love the whole baby showers. We love the celebration of it all. But the important part is that you need to
have a good doctor. Have a good doctor, a good midwife.
Check out that website that she said. What was it called again?
I don't know which one. I can say a few websites.
The one that was like Yelp for doctors.
Oh,
and hospitals.
Earth app. Earth the app. Earth IRTH the THE app or it's Earth app IRTH.
It's basically a Yelp
app
for doctors and hospitals.
It's either the is in there or not in there. I looked it up the other day and I can't remember if it's the or no the and just Earth app. But it's excellent. It's like a Yelp.
Yeah. So look up who your doctor is. See how many.
That's not what it is on there.
Oh no, it's a hospital. Sorry.
No, it's not. And it's not the hospital. Listen, it's people who delivered.
Right.
And are giving reviews of their place of birth, and maybe their provider, maybe not, but they're not going to recommend. Oh, Dr. Jones, I don't think so. Dr. Jones at NYU is really great. If they had a great experience, they might. But they talk about their experiences, and so that it steers people to or away from particular hospital institutions. So it's a good thing for that. What do you look at? Earth app or Earth the app?
The Earth?
No, I didn't say the. I said Earth.
You said
I didn't say the. I said IRTH the app.
I don't think it's here.
It's there, Michelle.
I don't see it. Oh, here you go. There we go. IRTH. Birth without bias.
So hit it. What's the app?
That's it. I'm going to get the app just to look at it. But it basically is...
I want to know if it... Where's the?
Yeah, there is no the.
It's Earth app.
IRTH.
Yeah.
That's it. And then it will say hyphen next to it. And it will say
birth without bias. Okay.
Moms of color rate hospitals. That's basically what it is. And it has a 4.2 star rating. So it's pretty known. People know about it. Has good ratings. So you basically sign in from what I see. You sign in from your Google. You sign in from Facebook. And it helps make birth safer and more respectful for all. And I guess, like you said, you can look... What does it say? Learn what other parents of color say about their doctor and hospital experiences. Okay. So you can look up your doctor. I'm assuming you can look up the doctor from the search.
Yeah, you can Google your doctor too. You can Google your place of your delivery and see what the C-section rate is. Right. There's so much information out here for you to do and have at your fingertips now. So now more than ever, we have to be more engaging. It's a two-pronged thing. Yes, there has to be laws and there have to be things in place to prevent the biases and the problems that women are having that's killing us. But at the same time, we have to come to the table with some knowledge, advocating ourselves and walking and going other places that treat us with respect and dignity. So it's kind of like a two-pronged thing and not feeling like you don't have any choice because you do.
Yeah, and have your voice be heard, because a lot of people won't do it in fear of, I guess, rejection, or just feeling like it's not gonna matter. But it matters, and I actually have one of my friends who actually had my mother help her, coach her through delivering her twins. There'll be one.
Can't believe it.
That's crazy. That went by so quick. And
she's having a party?
Yeah, I'll send you an invite.
Oh.
She was going to come on the episode, but she, working mom, things she got to do. So it's no big deal. But she definitely will. She did make a video, though. I asked her to make a video.
Yes.
Explaining her pregnancy and her labor and how it all went and how the advice that my mother gave her in the educational part that she was giving her, like all the information, and what she did at the hospital and how it actually helped her in having a smoother pregnancy than what she thought would happen. So
yeah, I was I was just over the top having the birth she wanted. Mm-hmm. So the prize, the gold ring was not necessarily vaginal versus section, and she was very clear that for her baby's health and sake she would do whatever was necessary, but she walked in with a birth plan. Mm-hmm. She walked in with her clear ideals about the kind of birth she wanted, and she articulated that with her doctor, so much so he had to leave the room, come back and regroup and readdress her in a different way. I just was over the top. Mm-hmm. No cussing, no, threatening, nothing. Just articulated her position. And I'm just so proud of her for doing that. And I've had many success stories where women have mustered their strength and their will and their inner being to say, well, no, I really don't want to do this. I really want to do that. And knowing and educating themselves the reason as to why they want to do certain things, and taking that with them in the labor room and having the birth that they wanted. So it empowered them very much so.
Right. And you can also, if anybody's interested in any information, you can email my mom at childbirthedwithjan, Jan, at gmail.com to have any childbirth classes,
questions. You want to do one-to-one consultations. What I do is like one-to-one consultations throughout your birth. So you will talk periodically about how the pregnancy is going, what you're doing, advocating. I see myself as a resource person, giving you those resources that can help you in your journey, and breastfeeding resources, education resources, and so forth.
Yeah, so I'll put that in the description for you guys to get if you guys didn't write it down. But I think, thanks, Mom, for coming on.
You're welcome, dear.
Thanks for the information. I hope you guys take this information and use it wisely, please. And don't just, don't feel afraid. Don't be nervous in asking anything that you need to ask. She's an open book. She will let you know what you need to know. And yeah, so I hope you guys have a great night. Don't let the things of today that stressed you out and bothered you and pissed you off go into tomorrow. Leave it here, leave it today. And enjoy the rest of your night, guys. I will see you later. Bye.